So I'm speaking to you from Misaskatoon Atik Aski, the Saskatoon Berry Bush Place, also known as Saskatoon, Saskatchewan, on Treaty 6 territory and the homeland of the Métis Nation. And I like to think, is it possible that among the ancestors who are joining us tonight might be the leaders who signed Treaty 6 in 1876, and who did so with all of us and our well-being and the well-being of this land in mind? And perhaps we're also being joined by the leaders of the Métis, who settled here also in the 1800s and who came looking for their own land and justice and dignity. The subject of tonight's Nature City conversation is a new model of healthcare that connects the dots between the health of the living world and our own health as living beings. I can't help but think how obvious that connection likely seems to all the ancestors. In a few minutes, we are going to hear from two visionary young women who are renewing our understanding that nature is medicine. After their presentation, there will be time for discussion, so please, at any time, place your comments and your questions in the chat, and we will get to them a little later. And now, it is my honor to introduce tonight's featured guests. Brooklyn Rawlyk is a third-year medical student at the University of Saskatchewan with a passion for fitness, planetary health, time spent outdoors, and learning new skills. She is currently interested in the field of ophthalmology and in ways to mitigate the carbon footprint of surgical care. She is a graduate of Dalhousie University, where she was a cross-country and track and field varsity athlete. She tells us she is always looking for new connections and ways to engage with her local community. Sehjal Bhargava, our other speaker, is in her final year of medical studies, also at the U of S, with interests in public health, primary care, climate change, and health equity. She obtained an undergraduate degree in kinesiology from the University of Saskatchewan. Another athlete also competed in varsity track and field and cross country prior to attending medical school. In her second year of med school, Sehjal co-founded the Planetary Health Student Group within the College of Medicine, and most recently helped launch and currently co-chairs the Saskatchewan chapter of the Canadian Association of Physicians for the Environment. She's excited to integrate practicing medicine with climate advocacy into her future career as a physician. Brooklyn and Sehjal, it's over to you.
Thank you so much for that wonderful introduction, and it is so exciting to be with you all tonight. Is my audio and video coming through okay?
Yes.
Someone can just give me a nod. Okay, perfect. So thank you so much for the warm welcome. Brooklyn and I will be presenting tonight, and Brooklyn will just have her camera off as she is the one sharing our slideshow and is having some internet bandwidth capacity issues. So Brooklyn will be sharing the slides and speaking with her camera off. So before we get started, just would love to take a second to introduce ourselves. We are two medical students, and I think students is the operative word of that. We are in our learning journey, and this is something that we've discovered throughout our time in medical school because of our passion for the environment and climate change. And we're so excited to be with a group of like-minded individuals tonight. So this is our presentation on how we think nature is medicine and the evidence that that shows that, as well as our experience with prescription nature in Saskatchewan.
Thank you, Sehjal. Can you hear me all right? Am I cutting out at all?
No, you're good.
Okay. Yeah, sorry everyone, I'd love to have my camera on, but during that lovely introduction that Candace gave, I looked like I kept glitching out like a scary movie. So we'll try to prevent that from happening tonight. So first of all, as we gather here today, we would like to start with a land recognition. We acknowledge that we are on Treaty 4 and 6 territories and the homeland of the Métis, and we want to take a moment to respect the First Nations and Métis ancestors of this place and reaffirm our relationship with one another. And as Sehjal mentioned, especially as students, and as we are going to speak to some of our knowledges that are mainly from a westernized perspective, we need to recognize that learning occurred on this land prior to the presence of this institution. We also wanted to show you a few objectives for this presentation and what we hope to get out of this tonight. We are also hoping to be able to engage in discussion with members of the audience or if other people have questions, especially as we'll be speaking to prescription nature and some of the evidence, but we might not be as familiar as some of you in the audience when it comes to public engagement and about protecting natural spaces. So we hope that this conversation can kind of help be a collaboration per se and kind of engage in a conversation as we all have the same goal of protecting nature and being able to enjoy it as long as we can.
Perfect. Thank you, Brooklyn. So kicking this presentation off with a bit of a self-situation in terms of where we are coming from. Brooklyn and I are both a part and members of the Canadian Association of Physicians for the Environment nationally, and as well as being a part of the Saskatchewan regional chapter. So we actually recently launched the Saskatchewan regional chapter as a way to bring climate advocacy from a healthcare perspective to Saskatchewan locally. We currently are a group of about, I'd say, 15 really dedicated interdisciplinary individuals who focus on climate change as a health risk factor and try to focus our advocacy efforts at a political sphere as well as a grassroots scale, as well as in hospitals as a way to recognize that healthcare is complicit in, in the pollution that we have, it being dependent on fossil fuels. So we're an incredible group of interdisciplinary healthcare professionals who are dedicated to environmental advocacy. We're always looking for new members. You can casually join our mailing list, which is about 50 people large. So you can keep up to date with what we're doing. But this is a part of the organization, or this is an organization that we're a part of and part of the major group who helped launch Prescription Nature here in Saskatchewan. So speaking as medical students, this is one of my favorite slides. It's from originally a website, but I found it on a presentation that a mentor gave. This is a model of what makes Canadians sick. Healthcare is so multifactorial. We know that health is not just determined within the four walls of a clinic, and that health is so often a result of the social determinants of health and our environment around us. And this chart, which basically demonstrates the way that health is composed, shows that 50% of our health is our life, and that's the social determinants of health. So these are things that may be more distal to us or more close to us or more proximal, maybe modifiable or not, but there are things that we need to be considering as healthcare professionals that do affect the health of our future patients, and that we know that a large part of our life is the environment that we live within, and therefore climate is a part of healthcare, and that's part of our lens that we come to this with.
So we want to take a minute to introduce what Prescription Nature is, if you haven't heard about it in the news or read about it online. And as medical professionals and medical students, we love to use acronyms. So the PA is for PaRx and the RX is for prescription. So it's known as PaRx prescription. And this is the formalized program that is here in Canada. There are formalized programs like PaRx in other countries. However, when we're talking about PaRx in Canada, the evidence base really suggests that you should be spending at least 20 minutes at a time with nature at a minimum of 2 hours a week. And Sehjal will touch a bit on the evidence that supports why these numbers are recommended, but ideally, the cortisol stress hormone in your body seems to drop most effectively at about that 20 to 30 minute interval. So that is where these guidelines come from. And when we're talking about nature time, we have to ask ourselves, what does that mean? Does that mean I need to be going for a beautiful hike in the mountains? Do I need to be near Cranberry Flats in Saskatoon? What is nature time? And really something that we like to speak about in these presentations is that Nature time can be any personally meaningful time spent. So that can even be something as simple as going and sitting on a park bench surrounded by a few trees, or having a lunch with a friend during a lunch break outdoors. So really it can be flexible, and by that means accessible for anybody who is wanting to fill their prescription. And then when we talk about who can prescribe nature time, is any licensed healthcare professional in Saskatchewan. So this is from physicians and physiotherapists, occupational therapists, and the list goes on. So really, this is a great collaborative movement across healthcare professionals. And for Sejal and I in particular here, both as medical students and runners, as we ran for varsity teams at our universities, and as nature lovers, we've experienced what incredible benefits come from spending time outdoors in nature. And so when we kind of reflect on our own experiences and what lifts us up, we thought, why should this stop us from sharing something like this with patients, especially if there is one area or one website that can have all of this evidence together and be accessible for the public. And this also kind of fits into something called social prescribing. And as medical students, this is something that actually has become a lot more popular and discussed. And this is what we're talking about when we look at having a healthy diet, or making sure we get enough sleep, or making sure you have exercise. And we truly believe that nature should be that fourth pillar of health. So just as, for instance, if you see a family doctor and they go over any medications that you're on, or they want to ask at a visit how those things have been going, this should also be a part of your prescription, this time spent in nature, so that your physician can check in with you and ask, well, have you been able to make that change? Or how can I help you find ways to implement nature in your life? And for us too, and as Sejal mentioned of Cape Saskatchewan, really for us, it is an environmental movement in itself. Some of these little blurbs to the right are from the PaRx prescription website. And it really just comes to show that if we can engage the public and get individuals interested and invested in nature at a young age, children are more likely to be environmentalists. Individuals are more likely to feel connected and have a need and strong desire to try to protect nature. And we know that with climate change, being able to protect our grasslands and protect our forests are so important when we look at ways to offset carbon emissions. So Sejal here is going to go into a bit of the evidence, and we know we don't need to convince all of you here today why you should be out in nature, but it is nice just to quickly explore to give the backbone for what PaRx prescription was. And here, as we have two images of nature per se, we wanted to touch closely on some of these theories that are the foundation of PaRx. And I'll speak quickly to the attention restoration theory. And the idea here is every day we go through many cognitively demanding tasks, whether that is through your work, trying to manage different areas of your life, and it can be really draining. And especially for us in the medical field, we talk about things like physician burnout, we talk about mental fatigue, and this is where mistakes can be made, and this is where your emotions can run high. So the idea of attention restoration is that nature, though it takes your attention, it's rather a soft focus. And through that soft focus, you don't need to be undergoing many cognitive demanding processes. And in that way, it's actually a way to re-energize your system and help you be able to go back to those cognitive tasks that you might need to for the rest of your day.
The second theory that we have listed here is called the psychoevolutionary theory. So it speaks to a more emotionally based mechanism for why nature is so beneficial for us as humans. It speaks from a more evolutionary perspective where time in nature was often something that was inherently stress reducing and something that we as humans crave in terms of just being in that relaxed natural environment. So it speaks more to the emotional setting that, you know, when you're in nature, you naturally are more calm and have that stress reduction and that immediate subconscious emotional response that nature can give to you in terms of feeling in awe or grateful for where you are or seeing greenery, like Brooklyn even mentioned. I don't know about you guys, but personally, like when I step into a forest, I immediately feel a sense of calm wash over me. So the psychoevolutionary theory kind of speaks to an individual's reaction to the environment and how nature is more restorative than an urban environment per se. So the next slide gets into the scientific nitty-gritty of why prescription nature was launched and how we can prescribe it as healthcare professionals. Essentially, nature has been something that has been always widely considered to have health benefits. And what prescription nature has effectively done is collate the evidence that exists around spending time in nature and now has it synthesized into a website and into a formalized prescription for healthcare professionals. So the first study for this left on your screen that says urban nature experiences reduce stress in the context of daily life based on salivary biomarkers is basically a study that Brooklyn mentioned earlier that speaks to measures of human stress hormones. So salivary cortisol is what your body releases when you're stressed. So scientists took samples of salivary cortisol before and after spending time in nature and found that the biggest drop in stress hormones was found after spending about 20 minutes in nature. There was a large drop off in the stress hormone. And we know that the more time spent in nature, the even bigger drop in stress hormone you can have. But just what the study showed was that the biggest bang for your buck in terms of minutes in nature existed at 20 minutes. And so after that, you do have continued benefits, but the biggest effect happens in those first 20 minutes, which is how we came up with the 20 minute per dose nature time marker. The second study, or the one on the top right, says 9 in 10 Canadians say they feel connected, or say that when connected to nature, they feel happier, which inherently speaks to that emotional response that we get from spending time in nature and speaks to the importance of being able to access nature in your daily life. The report or the study in the middle says neighborhood green space and health in a large urban center, which actually was a really interesting study. They looked at satellite images of trees in Toronto and correlated that to self-reported health measures from people living in these different urban areas. The results that came out of it were quite stunning, actually, in that people who lived in neighborhoods that had more tree coverage actually reported having higher self-reported happiness, feeling like they were living as if they had a higher income than they actually did. That was all kind of contributed back to controlling for a lot of the social determinants of health. It was mainly contributed back to the actual presence of greenery and trees in their neighborhood. So that was interesting. And the study on the bottom there says spending at least 120 minutes a week in nature is associated with good health and well-being. And again, that's kind of where the dosage number came from, was from a study like that actually quantified the time in nature that gives us the most benefits. So really interesting to see all of these studies that actually prove that time in nature is healthy. And that we know that there's also studies that say that adults who spend time in nature have a bigger drive to protect it. And like Brooklyn mentioned, I think prescription nature ties it all up in a nice bow, in that we as healthcare professionals can get a 2-for-1 where our patients are happier and healthier from spending time in nature, but may also become environmentalists from spending more time in nature because of the connection that they feel to the world around them. This is another study that's kind of funny. So this is one that looked at surgery patients, or people who had just had surgery. So a cholecystectomy is gallbladder removal surgery. And it found that people recovering that had a view of trees versus a view of bricks actually had a way better health outcome after their hospital stay. So if anyone ends up in a hospital for whatever reason, try and ask for a room with a view. It had a reduced length of stay, reduced use of pain medications. The nurse notes regarding the patients that they were attending to were more positive for the patients that had a view of green space rather than a brick wall, saying, oh, the patient was in really good spirits today, or patient was really optimistic about recovery. And the nursing notes for the people who looked at a brick wall were just a little bit less positive. And actually people who had views of nature while recovering from surgery had less post-surgical complications. So really interesting study there. And I think the other thing that's interesting about this is it actually reflects not even a need to spend time in nature, but rather even just a need to even see nature. So if spending time in nature is ever something that is viewed as inaccessible to someone for whatever reason, looking through a window or even looking at time in nature, or a picture of nature, can be restorative.
So, as you may have guessed, really the health benefits can be attained through many versions of nature. And so, really, when we're talking about the benefits for one another and ways to implement this in our lives, this is something that we're excited about because it doesn't mean that you need to have the physical ability to run or even walk to be able to really soak up some of these benefits. And that's what we love, to be able to have that discussion with patients and try to help break down their barriers to access of nature. However, though that might mean, for instance, a manicured park per se, like something that the city puts together versus protecting grasslands or natural lands, which a lot of you might be passionate about, even though maybe the effects to us individually wouldn't change, something we'll dig into a little bit later in the presentation is the importance of protecting those lands from a climate change standpoint. So, here we're going to talk about why we care from a health professional lens. And as you heard, we care from a health professional lens because we care about patient health. And here we just wanted to show you a few of the resources that come out of the website. So, for instance, if you were to see a family doctor, you might be given a prescription pad as seen on the left. And the idea is that with your physician, they might help you find what is most accessible to you or what are some kind of first steps to help you be able to get outdoors. And if anyone is interested, through the website, there is so many resources. Some of actually all of the articles that Sehjal has mentioned are all accessible there. And there's different patient sheets that you can share with friends and family or even read yourself for more interest's sake. But something that we want to go into a little bit deeper and about why we care as physicians is in regards to the climate crisis. So Sehjal is going to speak a little bit more to the bigger picture beyond just the protective chronic disease nature of being outdoors or how it can lower your blood pressure.
Yeah, thanks. So, one of the biggest paradigm shifts I think I've seen is that the climate crisis has moved from just being this ecological thing that, the polar bears are dying and the ice caps are melting and the coral reefs are being bleached. That messaging is still there, but now it's also becoming a health message. So, the message that we try to get across with anytime that we advocate for climate change from a health perspective is that the climate crisis actually equals a health crisis. And the way that we can think about it is that the way that climate change influences the world around us actually exacerbates or creates basically risk factors for different diseases that people can have, or increase the risk of someone getting a disease. So some of the research that I've done points to some of these linkages. For example, increased ambient temperatures, so air temperatures, actually results in increased rates of aggression in people, as well as violent suicides, especially for those who are directly impacted by a changing climate. So those who rely on a water cycle, or who rely on a flowing river for water. So example, farmers was one. An increased occurrence of climate disasters like we saw in British Columbia this summer with the heat dome and the wildfires can lead to mental health disorders like PTSD, adjustment disorder, which is basically a smaller or less severe PTSD, depression, and increased immigration and refugee populations, which has a huge impact on the people who were displaced as well as the people who have to support them. Increased rates of physical illness exacerbations. So, for example, chronic obstructive pulmonary disease or COPD, cardiovascular illnesses like heart failure, renal failure, and cancers can actually become worsened by an unstable climate or not being able to be in an air conditioned space or having to deal with heat stroke, for example, or breathing polluted air can actually lead to even worsening of these illnesses, but also concomitant increases in anxiety and depression in people who already have these chronic diseases. Economic instability and income security is again attacking one of those more social determinants of health. If you're dealing with income instability, you may not have the resources to stay healthy, and climate change can make that even worse. A decrement in social capital can lead to a reduction in well-being and the onset of mental health problems, income anxiety, and things like that. Climate anxiety is a whole new diagnosis that's being explored. It's not actually, I don't think maybe I saw one article about someone finally being diagnosed with climate anxiety, but it's a well-known phenomenon that we know that as soon as people, and I know I'm speaking to like-minded people when I see people nodding, as soon as you start to really think about what it means to have ecological collapse and all these effects of climate change, you're like, how the heck is this going to work out? You get doom and gloom, and you get frustrated, and you get sad, and that's all kind of culminated in what we call eco-anxiety or climate anxiety, which is the increased incidence of mental health and physical health problems, like because of climate change and its impact on mental health and physical health, as well as the world as we know it, right? So trauma, shock, anxiety, depression, PTSD, substance use, hypertension, heart disease are even more of the things that can be even further impacted with someone who's also dealing with climate anxiety. So this slide, I think, really just draws attention to why the climate crisis is a health crisis and why we as healthcare professionals need to be caring about conserving the climate. This is one of my favorite models. It's not a hard diagram to look at, but when you start to understand the layers, it begins to make even more sense. And I found myself just being like, oh gosh, that's actually a really good way to summarize everything. So beyond the benefit of nature for health, we know that our hospitals, which is the most inner circle there, relies, and the people who are in the hospitals and people who seek the services of hospitals, health is determined by social and structural determinants of health. But those social and structural determinants of health, as we know them, are actually controlled by the ecological determinants of health. So, for example, hospitals require ventilation, right? We require clean air to be able to put into ventilators, to air condition, to clean our ORs, whatever. If there's a certain amount of air pollution in terms of like particulate matter or something, perhaps the air quality in hospitals is actually going to decrease, and that's going to have an immediate impact on our patients. We rely on having clean water and saline and sterility. And if that's an inaccessible thing because water becomes a scarce resource, then the quality of care we can provide in hospitals shifts. And so for this reason, it's another reason that healthcare professionals and patients alike should all really be concerned about the environment, because our wellness depends on the stability of our environment.
So that is kind of a bit from our perspective as future healthcare professionals, but we also wanted to merge the conversation, and hopefully this is where we'll be able to have discussion with the audience or take questions, because we want to talk about the piece that brings together climate change and the importance of protecting natural landscapes. I was actually just at a conference in Vancouver this past Monday. And for any of those who are following with the Globe conference that's happening there for the rest of the week. And one of the things that came up was the importance of protecting grasslands. I met someone there who works at the International Institute for Sustainable Development. And we started to discuss just how important it is to be able to protect our grasslands and how they can actually be better at carbon capture than some of our forests, because our forests are at a really high risk of burning down. So when we're looking at protecting these grasslands, we're looking at not only protecting habitat and storing carbon and improving water retention quality, but we also need to be able to educate and make sure to, in the forms of policy or coming towards government, to prevent pasture areas from being converted to monoculture crop farms. So this was something that we wanted to discuss and thought would be a great conversation to have with Wild About Saskatoon.
Oops, sorry, I muted myself. I'm back. So a concept that Brooklyn spoke to earlier was, why we should protect our natural areas as they are instead of making and constructing new beautiful areas that are more well manicured and less wild per se. This is when I was doing some reading about grasslands and grasslands as carbon sinks. I came across this article that said grasslands store an estimated 2 to 3 billion tons of carbon in their root systems and soil, making them some of the highest carbon stocks in the world. And I think that that is so unique, because so often we think of rainforests as our biggest carbon sinks, and the Amazon rainforest burning down is a huge ecological disaster, which it is. But it also speaks to the advantage we have in the prairies here and the job we have to do to protect our own natural environment here as having grasslands. Basically, preserving environments as they are gives us more wild places to go spend time in nature, as well as the ecological advantages of having that carbon sequestration and storage in a more natural way. You can hop into the next slide here, Brooklyn. So I thought this was a really interesting study. It's from California, but I thought we could just like translate it to the prairies here because I thought it was just equally as relevant. It's speaking to actually the science behind why forests are, not as effective carbon sink as grasslands. Grasslands basically are a more resilient ecosystem to disasters and climate change, where forests rely on a really stable environment and not being affected by things like wildfires and droughts, whereas grasslands are a really versatile landscape that can, that because of their high rates of productivity and enhanced carbon sequestration can really be effective carbon sinks. One of the quotes from the study said, "Looking ahead, our model simulations show that grasslands store more carbon than forests because they are less impacted by droughts and wildfires. And unlike forests, grasslands sequester most of their carbon underground, while forests store mostly in woody biomass and leaves." So I think this just speaks to the importance of what we have here in Saskatchewan and the importance of preserving it.
So, a lot of the things that we've spoken about today can kind of be taken at a federal or provincial or municipal level. And again, when I was at a conference this weekend, and as many of you might know, when we look at carbon emissions, and for those of us who are really passionate about climate change, really 50% of carbon emissions can be addressed at the municipal level. And looking into some of the work that Wild About Saskatoon does, I just wanted to share this incredible resource that came across my inbox. It's called the Infiltration Manual, and it talks about how to push for ambitious climate action at the municipal level. And here in the purple, we kind of start to break down what areas of jurisdiction we can start to talk to with our cities. And especially specific to this talk, we're talking about ecosystem protection, about land use. And something that we're also passionate about is increasing green space in Saskatoon. So again, this was just a resource I wanted to share and to bring up in this conversation if anyone has questions or discussion, because we see this as an opportunity to work with organizations within Saskatoon who are as equally as passionate about protecting the ecosystem, and to tell you that really there is a movement within the healthcare system and healthcare professionals who also want to work with you. And as I wrote down here, that PaRx is like a hidden environmentalist movement. And if we can be able to work together, really showing government how this is important, not only for protection of biodiversity and for climate change, but also for human health, it just can allow for the spread of impact to increase and really create a ripple effect. And lastly, we were asked too if we knew anything about how much green space is accessible in the city of Saskatoon. And really, this is not something that I'm not sure if Sehjal is, but not something that I'm personally very familiar with. But when I was doing some research, I came across a report that was done recently by the Mewasan in 2019. And basically, they did quite a bit of analyses and just trying to estimate and give an idea of just how much natural space is accessible around the city. And according to their report, they report that 82% of the population of Saskatoon should be within a 5-minute walking distance to some sort of green space. And really, that is quite incredible, especially when speaking with some of my colleagues in Toronto, where they are quite literally living in a concrete jungle. And to the far left here with this kind of circular diagram, they started to also break down the city of Saskatoon as a green network. And they kind of broke it down into how much agricultural land versus enhanced assets. So we're thinking of manicured parks versus natural assets. They just kind of start to show the variation of what they consider green network and nature space, including the river, is available. And lastly, to the far upper right corner in this report, that they mentioned that there should be about 0.77 meters per person of green space per capita, which is a rather interesting statistic. But we just wanted to put this in the conversation to discuss that though this is great, this doesn't also speak to the fact that there are a lot of accessibility needs within our city, especially when we talk about public transportation and getting people access to some of the incredible gems that we even have sitting just a little bit outside of the city, like Cranberry Flats, or even like Ferdale Natural Area, or I usually go and bring my dog when I can take a break from studying. So this is an equally important part of the conversation, to not only try to preserve the landscapes we have, but also to advocate for where can we increase green space, or how do we kind of minimize how much more land permits or building of buildings can happen without taking into account what green space or natural lands we could be losing.
So thank you so much for entertaining us and entertaining our perspective today. That is the bulk of the information that we have for you from in a more formal perspective in the form of slides. But we basically wanted to just leave the conversation with a discussion, or with some prompts for discussion, because we would love to learn from you as well. So these are some of the questions that we thought we could have you guys reflect on after the presentation, as well as things that we would love to hear from you. So how can you see yourself integrating more time in nature into your day, recognizing that 2 hours a week, 20 minutes per dose is kind of the evidence-based guideline, if you will. What are some ideas or examples of action that you have taken at a political level to preserve nature or advocate for climate policy locally, provincially, nationally, in your own pursuits? And lastly, one question that I'm particularly interested in as a member of CAPE is, what are some of the ways that you can see healthcare professionals collaborating with the work that you do on climate change? So thank you so much again. I'll leave it to Brooklyn to say her last words as well, but would love to hear your thoughts on some of these questions, and just thank you so much for having us here today.
Yes, thank you so much. I was going to try and turn my camera on without, but I don't know, am I still freezing again?
Yeah.
Oh no, okay. I'll continue to be black box behind, but equally as appreciative, as Sehjal had mentioned.
Thanks.
Invisible Amanda, are you able to put us into the panel format? I can't tell. Already done. Look at that. She's so far ahead of us. Thank you both very much for that really deep presentation. You are, of course, here preaching to the choir, but the choir needs to be preached to as well. We need to know that we're not alone as we try to respond to these really enormous challenges. So thank you for all the information, and more than that, for the inspiration of the action that you're taking. I mean, you're still in school. We're grateful for all this leadership. Now, I don't yet see any questions or comments in the chat, but if you have things that you would like to say, points you would like to make, please let us know. And then instantaneously, we do have a question. When is this program being launched? Now, I think they mean the PaRx prescriptions program, and I think it's up and running. Is that correct?
Yes, you are correct. Prescription Nature was launched in Saskatchewan in July of last year. So it's now being able to be prescribed by any licensed healthcare professional. So if you happen to go to yours and they don't know about it, you can always tell them to look up the website and register to become a prescriber. It's a good way to take your healthcare into your own hands and advocate for yourself and your needs. But most, I think we have about, last I heard, we had about 80 prescribers across the province. And maybe Brooklyn can speak to this if I misspeak, but recently there was a collaboration with PaRx Canada launched with Prescription Nature, where doctors can now prescribe PaRx passes, or the Adult Discovery Pass, for access to PaRx Canada PaRx for free, essentially. I think they can prescribe one per month to a patient who demonstrates desire and motivation to use that kind of a resource. So it's launched, and you can definitely ask about it. But that's a great question. Oh, Brooklyn has linked a link in the chat. If that can be shared with everyone, that would be great.
Yeah, and kind of echoing what Sehjal mentioned as well, I apologize that we didn't include the launch date for when PaRx prescriptions came to Saskatchewan, but especially now with the relationship with PaRx Canada that has been getting a lot of media coverage. And I definitely encourage you to check out the PaRx prescription website. I'm supposed to put it in the chat. Oh, I might have it in the wrong chat here. I'll
No,
make sure to share
yeah,
that.
it's good.
Oh, I
You
did?
did it
Okay. So
perfectly.
feel
Yeah.
free to click on that. This is the specific blog post that talks about the PaRx Discovery Pass with the PaRx Canada relationship, but this website has so much incredible information. And I know, especially when I'm in a conversation with a skeptic or even a distant relative who kind of wants to know a little bit more, it's nice to have a website to send them to and to do some light reading because the evidence base is incredible.
So are these prescriptions recognized by insurance companies? Really, do you get a free park pass? What are they these kinds of benefits?
Great question. So, unfortunately, no, it's not recognized by any sort of insurance agencies, and yes, like that part of it, unfortunately, isn't incorporated into the structure of it. But yes, you can get a Parks Pass for free. I think it's originally the pass is $72, and you can get that prescribed to you by your physician via their website link and affiliation.
Through
Good
this
question.
new program,
Yes.
with Parks Canada.
Yes. But
That's
the actual, as Brooklyn has said in the chat, the actual prescription itself is free of charge, and it's something that you can talk to your doctor about.
right. And yeah, maybe, you could wave it in front of your employer's face and say to have your coffee break outside.
Exactly.
Caitlin comments, I highly recommend getting a dog or borrowing a friend's because they definitely ensure you get outside. And I was thinking about that too as you were making your presentation. 20 minutes a day when you have a dog or dogs is really no problem.
Definitely. Yeah, for sure.
And it does absolutely totally lift your mood. I remember reading a study that was done a few years ago, which they compared people who walked from one place to another indoors with a group of people who made the same trip but outdoors. And the people who had walked outdoors just reported feeling better at the
Absolutely.
end. That tiny experience.
I love that.
Yeah. Caitlin also comments, I had never really thought much of the impact that the healthcare sector has on the climate. I think it's such an interesting point of view, and I appreciate the information that you've shared. So are you saying that all physicians should be environmental activists? And if that's what you're saying, do you find that reflected in your training?
That is such a fun and fantastic question. Something Brooklyn and I feel very, very passionate about. I think inherently, yes. I think especially when we consider the role of a doctor, I think that it's become so much more than just prescribing medication and being an expert in, bio or like physiology, let's say. It's now becoming acknowledging that health is so much more than just what we can do in a clinical encounter. It's about income, it's about education, it's about access, it's about disability and ways that we can counteract that in society. I'm hoping to go into public health. I'm waiting to hear where I end up being able to train next year, but it's something that I wholeheartedly believe that climate change is actually a public health crisis, and it's something that should be looked at within the scope of environmental health within public health. And I do agree that all physicians should be activists if they really do care about the most upstream determinant of health, which is our environment and our climate. So when we think of the education that we receive, there's actually a whole movement currently within medical learner culture that climate change and the impact that climate change has on health should be integrated into curriculum, into medical school curriculum. And it actually most recently got approved to be one of the objectives that we are trained to understand at a national level. To be a medical graduate, you have to understand the effect that climate change has on health and ways that you can mitigate it. At a local level, Brooklyn and I have been really closely involved with and we're parts of advocating to actually increase climate change content in our curriculum. we created a case study that demonstrated the link between climate change, namely wildfires, and adult respiratory health with COPD, kind of highlighting some of the health challenges that someone living in a rural, more farming community might face in with struggles from wildfire smoke from BC or La Ronge or Northern Sask, wherever it may be coming from, and the fact that that has mental as well as physical health impacts. So at a local level, we definitely are advocating for all of our peers to have somewhat of an exposure that climate change is actually cited by the World Health Organization to be the greatest threat to human health in the 21st century, and that medical education should really reflect that. So I think it's something that's definitely up and coming. I would say 98% of my classmates are aware that climate change has an impact on health. And I hope it's just something that continues to grow and gain more attention and impact.
I just want to quickly add something too, because you know what? A lot of people are surprised. I was just at a climate change conference on Monday, and I was one of 2 medical students out of 100 delegates across Canada working on climate change. And when people found out that I was a medical student, they were so shocked. They were like, "What are you doing here?" And something that the audience might appreciate is the evidence suggests that if healthcare were an actual country, it would be the 5th highest carbon emitter in the world. So when we put that into perspective, and as we are individuals who want the best for patients and we talk about patient care, it's difficult to be working in a system that is at the same time also leading to environmental harm. So we really feel that we've been trying to increase the amount of education at the medical student level, because that is what's going to help form advocates and hopefully the next movement of physicians who are passionate about especially waste reduction and about ways to protect the environment. So yes, thanks for bringing up that comment. It is something we're both very passionate about, and it is really hard to kind of find that intersectionality between silos when different industries start to kind of wonder, oh, well, what is your role as a medical student?
Would love to hear more about the conference you were at, but there's so many, many comments here and questions. And I do have another idea that I would like to interpose, and that is, I think that, yes, climate change is a pressing issue with obvious health impacts, but we are also suffering an enormous biodiversity crisis, which has, for those of us in an urban area, I suppose, less obvious impacts, but the psychological impacts of knowing that species are blinking out around us can be very devastating. And the lack of the loss, cumulative loss of access to quality natural spaces, to quiet in urban areas, these are also health determinants. So, yeah. All right. Back to the questions from
well said.
from the rest of the group here. So you will be glad to know, Sehjal and Brooklyn, that you have someone here working at the U of R who's working on a policy brief for a local nature organization about the mental health benefits of nature. So 3 cheers for you.
Absolutely.
Yeah. Someone would like to know, Scott would like to know, how challenging is it for physicians to prescribe quality nature health programming and follow up for their patients, thinking about the physician shortage and challenges of time?
It's a great question, Scott, honestly. And it's like another thing that doctors are adding onto their plate, but arguably something with really high impact that affects, a lot of aspects of health. So to me, and I'm hoping to integrate it into my future practice as a family physician, in terms of anytime we talk about a diagnosis, there's many different ways that we can intervene, right? There's models like the biopsychosocial model, where it's like we should talk you through biological ways, psychological ways, and social ways to counteract the effects of like depression or COPD or asthma or whatever it may be that you have going on in your life. So for us, what I would ideally see nature prescription is like, oh, have you actually considered spending time in nature as something that you do for your health? Yes or no, blah, blah, blah. And then I think the beautiful part of this is like, it's like almost negotiating not to say that they're the same, but it's almost like talking about exercise or any other like behavioral intervention, right? It's like, how do you see this fitting into your day? Is this something that like you knew about that has health benefits? If so, what are some of the ways that you can see this fitting into your day? And I think that the best part of this is that it's not something that a physician can just tell you to go and do, right? You have to take it upon yourself to say, how can I incorporate nature into my life? What's the easiest way for me to do that? What kind of access do I have? What are the barriers I have to access? And those are some things you can talk about with your physician. So to me, it's just like following up on any other part of your care. How's that prescription dose increase going? How's your time in nature prescription going? How's your exercise coming along? I think it's just kind of like another one of those things that you can hopefully just integrate kind of into an appointment in not a super difficult way. But yeah, thinking about the physician shortages and challenges of time is definitely a barrier. And it's something that, I think it depends on an individual basis in terms of physician's time. But the other thing is that you just have to be a licensed healthcare professional to prescribe it. So it's not even just physicians. We have nursing colleagues, pharmacist colleagues. I have friends from my kinesiology degree who ended up being physiotherapists who are now prescribing nature to their patients. So the wonderful thing is that it's a shared load, and we can partner with interdisciplinary colleagues to get this done too.
So in case not knowing where to go and have nature experiences around Saskatoon is a barrier, I should point out that on the Wild About Saskatoon website, you will find now about 2 years worth of monthly adventure guides.
Amazing.
Telling you how to get to some of the amazing places around the city and what you might experience there. So be sure to check that out. We also have a podcast called the Nature City Podcast, which the objective again is to let people know who they might meet when they venture out into these urban wilds. So I can see that there has also been a question here, which Brooklyn is beginning to answer. Can dietitians join the Physicians Association, the Canadian Association of Physicians for the Environment?
Exactly. Yeah, I just put the CAPE email in the chat here. Just because I know this is going to make Sage look quite happy. It is funny that it says Canadian Association of Physicians for the Environment, but it is an interdisciplinary team, and we are always looking for passionate individuals to join, dietitians especially, because we're also very interested in food waste management and in local produce implementation into healthcare or into hospitals. So thanks for reaching out.
Are all physicians in Saskatchewan aware of this program? The PaRx prescription program?
Yeah, it's a good question, and I'm gonna just say no. We tried our best. We launched
It's an ongoing process.
Yeah, it's an ongoing process for sure. We launched it in July, and Brooklyn and I did a flurry of media interviews and published articles and such. And so we were hoping for the word to get around. We were promoting it within the Saskatchewan Medical Association and other key partners, the Saskatchewan Association of Nurse Practitioners, the Saskatchewan Public Health Association, the Family Physicians of Saskatchewan. All of these organizations were actually partners with us when we launched. So we were hoping that there was some advertising going on within their internal channels as well. But it's definitely an ongoing process. And that's why I always say, as a patient, if you go to your licensed healthcare practitioner and be like, I want a nature prescription, they can go to the website and read about it and register to become a prescriber and support you in your goals. So it's never a bad thing to take it to your healthcare professional to ask about, and maybe you can bring it to their attention if they're not already aware.
But it sounds like the PaRx prescription website is a good resource for all of us.
Mm-hmm. It's a very good hub, yes.
As advocates too for nature, because this is more information that we can use as part of our advocacy.
For sure.
For sure. Well, it's a very health specific scope, but yes, it's there for you.
Well, it's a real connection, isn't it? How could we possibly be healthy in an unhealthy world? So, yes.
Exactly, yeah.
Yeah. I can see the clock tells me that we have somehow spent an hour together. I know that now that we have met, Sehjal in Brooklyn, I can see so many ways that Wild About Saskatoon and other environmental organizations locally can work with you, and we can support one another. So it's so wonderful to make your acquaintance. Brooklyn, you're not looking your usual self tonight.
I'm looking a little grim.
But thank you both so much for this excellent presentation. Thank you again to Amanda for your behind the scenes wizardry. Thank you all for coming. We're really grateful that you spent this hour with us. Again, please check out the Wild About Saskatoon website, where you will find lots of resources there as well to help you go a little wild. So thank you very, very much, and good night.